hold ended.
Hello, I'm Dana Kennedy from Arizona. Thank you for joining us for today's Health Forum, hosted by AARP Arizona, with special guest Congressman Tom O'Halleran. We'll be discussing AARP health priorities for infrastructure currently being negotiated by Congress. It's unfair that America times what people in other countries say medicine. It's just wrong that you're forced to choose between sleep prescription or buying groceries. This is why AARP's priority is advocacy legislation to lower drug prices. We are calling on Congress to allow Medicare to negotiate drug companies for price. We also support limited price increase legislation. AARP urges drug price the rate of inflation. AARP also supports an out-of-pocket cap of costs in Medicare Part B. AARP's second priority is support family caregivers, the Credit for Caring Act to assist families with the financial challenges. This bipartisan legislation and up to $5,000 federal tax credit in family caregivers. Family caregivers are the backbone system in this country. AARP also supports home and community-based services. So these services means more as they age, not in institutions and hospitals. Proposals include workforce that provides services enough workers are willing to enter the profession and provide care will need in the future. And for our joint O'Halleran, welcome. If you're just joining, State Director for AARP, and I want to welcome you to the conversation with as Congressman Tom O'Halleran. Participating in one of these television talks, like radio talk, opportunity to ask questions live. If you'd like to ask a question, press star 3 on your to be connected with an AARP who will your name and to ask that question live. Please press star 3. I will be mentioning a turn to a lot of great information. One of our AARP and address is /8. Ask a question of Congressman. Please press star 3 on your connected with an AARP star 3. We're fortunate to have O'Halleran join us. Congressman, the floor is yours.
Thank you very much. Hello, everyone. My name is Tom O'Halleran. I represent Arizona's 1st Congressional District in the House of Representatives.
Thank you all for inviting me to be here today with you. I'm looking forward to discussing the healthcare policies that affect seniors like you and me. Last week, as a member of the House Energy and Commerce Committee, I voted to pass a comprehensive package of legislation that lowers the costs of prescription drugs, expands healthcare access and equity for our most vulnerable, and ensures that seniors who have paid into Medicare their entire lives are protected. Now the legislation we passed will move out of committee and head to the House floor for a vote. I look forward to reviewing the final legislation in detail, but I wanted to share with you some background and information about the votes we already took. We all know that too many hardworking Arizonans and Americans, especially seniors, are buried under the high cost of their necessary medications. For too long, these skyrocketing costs have forced Arizona seniors and America's seniors, veterans, and families to make a choice between life-saving medication and putting food on the table. That's why I voted to pass a measure that would lower the cost of these drugs, enable Medicare to negotiate prices, and cap out-of-pocket drug costs. while I'm incredibly disappointed that this provision failed in our committee, I do expect important drug pricing legislation will be included as part of a larger budget measure we passed this fall, and we'll be advocating for this legislation as we move forward. On the other hand, I'm excited that my bill, the Medicare Vision Act, passed as part of a package to expand Medicare to cover vision, dental, and hearing for the first time in the program's history. Eyeglasses, teeth cleanings, and hearing appointments are all essential factors to seniors' health. Our package also includes resources to expand access to health for millions of Americans by strengthening the Affordable Care Act, closing the Medicaid coverage gap, and makes long overdue investments in home and community-based care. With that, I'm sure you will all have questions about our bills and legislative actions, as well as what I'm hoping to see next. So I'm excited to open up the floor to questions.
Thank you, Congressman. Seems we're still having some technical difficulties with the audio there. I'll go ahead and take over. My name is Brendan Blake. I'm the Associate State Director of Advocacy. And for folks who have just joined our call, this is your chance to hear from and ask questions of Congressman O'Halleran, and to get the latest information about AARP's healthcare priorities of lowering the price of prescription drugs and providing resources for caregivers. Like the Congressman has alluded to, this is an interactive call, so if you would like to ask a question at any time during the call, please press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in the queue. The sooner you press *3, the sooner you will be on the line with Congressman O'Halleran. So, Congressman, we'll go ahead and start this off while we're waiting for some questions to come in. We have a couple of minutes in the meantime. So one of the questions that I'll start with is Americans have paid the highest prices in the world for prescription drugs. And for years, and prices have continued to rise during the COVID-19 pandemic. Why hasn't Congress taken action before now? And what are the chances of success this year?
I think this year, first of all, is an area that we'll have success in. Why hasn't Congress taken advantage of this or done something about it over the past few years that I've been here? We've tried time and time again. We tried last year and the year before that to get this passed, and we're unsuccessful. This year is a new year, and I think there's a new sense of urgency, and I think there's a sense of grassroots support for this throughout America by the American public, especially our seniors. Drug pricing is way too big of an issue to allow it to continue to have the negative impact it does on our families and our seniors.
Thank you, Congressman. And I know that this has been a topic of conversation that you and I have had over time, as well as that we've had on these teletown halls before. So we always thank you for your support on these issues. The next question that I'm going to ask you is regarding caregivers. Family caregivers provide about $470 billion with a B annually in unpaid care to their loved ones. As of 2015, Arizona family caregivers provided 749 million hours of care, totaling over $9.4 billion just in our state. Family caregivers also pay nearly $7,000 annually on out-of-pocket costs. What would the Credit for Caring Act do for family caregivers in Arizona?
Well, it invests, the legislation does, $190 billion to expand access to quality home-based services and care for millions of older adults and people with disabilities. So that'll have a profound impact on the ability to obtain that care, to have it at an affordable level, and to be able to have dramatic impact to at-home care for those that are senior citizens, but also, importantly, those that are disabled.
Thank you, Congressman. And before we get to our questions, I just want to remind everybody that if you have a question, please press *3 on your telephone keypad. So that way you will be connected with an AARP staff member and they will note your name and question and put you in the queue. And before we get to those, we're going to go ahead and take a moment to do a polling question. So the question that we have for you all is, we are going to do a prescription drugs audience engagement question, which you will press 1, 2, 3, or 4. So if you agree that the Senate should vote on legislation this fall to lower the price of prescription drugs by capping out-of-pocket costs for seniors, press 1. If you agree with consumer protections that prohibit drug makers from raising drug prices higher than the rate of inflation, press 2. If you agree that Medicare should be allowed to negotiate directly with drug companies on prices for prescription drugs, press 3, and press 4 for all of the above. Again, if you agree that the Senate should vote on legislation this fall to lower the cost of prescription drugs by capping out-of-pocket costs for seniors, press 1. If you agree with consumer protections that prohibit drug makers from raising drug prices higher than the rate of inflation, press 2. If you agree that Medicare should be allowed to negotiate directly with drug companies for the prices of prescription drugs, press 3, or for all of the above, press 4. Again, this is Brendan Blake with AARP. If you have a question, please press *3 on your telephone keypad, and we will note an AARP staff member will note your name and question and put you in the queue. We'll give it a minute before we go ahead and answer take a look at what our listeners are on the poll questions. Just as a quick check, Dana, have we been able to check your audio if you're back?
I think my audio is okay now. Is it working okay?
You're coming in great. Thank you, Dana.
Great. Well, I would love to ask the Congressman a question. Congressman, you travel all over the district and you've got a very large district. What are some of the issues that you hear about from constituents?
Well, the district's larger than the state of Illinois, so yes, it's a large district. You know, most of what we hear is frustration from a lot of people that know the seriousness of addressing healthcare, especially prescription drugs. We hear that all the time. But the other issues are accessibility in rural Arizona and rural America, the ability to have specialists nearby, the amount of doctors that will take Medicare patients, that's a difficult issue. And in general, having enough doctors, other than specialists even, in areas to be able to get the care that people need. And it shouldn't be that way. All Medicare patients should have some level of consistent care no matter where they live in America. Just because somebody chooses to live outside of an urban center doesn't mean that they have not participated in giving money through their work to fund Medicare, but also the idea that we as Americans have the right to live where we want to, and we should not feel that government is not addressing the issue as you had expected, as you were spending decades paying into Medicare.
Yeah, and Congressman, I really appreciate that answer, and I know we hear the same thing from our members. And I know that COVID has really impacted, especially seniors. And are you hearing any concerns about where we are as a country regarding COVID? And are there any things that that Congress is working on to decrease the numbers?
Well, COVID obviously is a tragic issue in our country. It's my wish that people would get vaccinated. It's critically important, and that it'll help us with getting this variant, especially right now. And there may be other variants in the future. And we're cognizant of that and keeping an eye on it. And we are going to be investing more, both in sciences, to be able to come up with more and more medications that will help with that. We'll invest in making sure we have vaccination programs available to people. And also on a worldwide basis, we are approving money to make sure that we have a collaborative process working with other countries. It's critical to our economy. It's critical to preserving our families and the health care of our citizens. And it's also meaningful that, as you saw at the beginning of the pandemic, when our country basically had to close down, it's open and moving the economy forward. We are competitive again, and we need to keep that strength. And by having those vaccines available to people and people taking those vaccines, it's something that's important to all of us.
Right. Again, I'm Dana Kennedy, State Director with AARP Arizona. If you would like to ask a question of the Congressman, press #3. We don't have questions coming in right now. I think part of that might be we had some technical difficulties with my audio in the very beginning, so people might not have heard that they could ask a question. And if you do want to ask a question, that's *3. But I'm fine with continuing this conversation. It's really important. Our long-term care facilities were really impacted by COVID. Are you hearing anything, at the national level as far as what we need to do to make sure that our long-term care facilities are properly staffed, have adequate PPE, and that we address, all the issues that have gone on in these long-term care facilities?
Both the state governments who have primary care or jurisdiction over those facilities and the federal government have taken a hard look at this. We are investing in making sure that those facilities will have the equipment necessary. The states are changing the regulatory environment so that that takes a position where there's more oversight to those facilities. I'm hopeful. Each state, there's 50 of them, they might have a different take on it. We will help guide them in that direction. And these bills also have some issues there that will help adjust that situation and help make sure that the qualifications of the people are at the highest standards, that the salaries of the people that care for our seniors is appropriate for the type of person that we need to be able to address those issues, and that we have much better oversight than occurred before in addressing that. And the idea that we were not able to have people's loved ones with them at such a time of need, that's unacceptable, and we're working on that also.
Yeah, I know that I worked really hard to make sure that we could get our families back into these facilities. We know that they often provided a lot of the care, and I sat on the governor's long-term care task force, and we did get family members in. I do know that we have the results of the poll. Brendan, if you want to go ahead and give the poll results, that would be great.
Yeah, that sounds great, Dana. We know that you are all listening because we do have some poll results, so please don't be shy and press *3 to ask a question of Congressman O'Halleran. It looks like we've got a couple people in the queue at this point. So the question, again, it was less of a question and more of just what would you support? If you agree that the Senate should vote on legislation this fall, which was related to the issue of capping out-of-pocket costs, we have 11%. If you agree that consumer protections should prohibit drug makers from raising drug prices higher than the rate of inflation, nobody, 0% on that one. If you agree that Medicare should be allowed to negotiate directly with drug companies for prices for prescription drugs, 33%, and 56% said all of the above. So I think that AARP's priorities, and Congressman, you've certainly been supportive of these initiatives yourself. So the majority of the people on the call that have participated in our poll agree with us there.
I'm very glad to hear that.
Likewise. We do have a question, Dana. Would you like me to go to that?
Yes, absolutely. Thank you, Brendan.
Great. All right. Jackie, can you hear us?
Yes.
Hi, Jackie. What is your question?
Who gets to determine how much outpatient therapy you need? I'm in therapy right now. I was in therapy. I had a surgery and then I had a stroke. And I was in therapy in the hospital. And then when I was discharged, I continued with outpatient therapy. And at first it was 3. It was TP, ST, and PT 3 times a week. And then it was down to 2. Now it's 1, and now they're talking about none. And I know I would benefit from much more therapy because I'm not at a point where I'm self-sufficient or by any means. But they told me I'm not progressing fast enough, I guess, which I don't know how all my friends and family, every time they see me, think I've improved so much. And I do too, but I know there's a lot more to go, and I would like to continue with the therapy. But who makes that decision? You don't need it anymore.
Well, first of all, I'm glad you're improving and that your family can see that firsthand. That's really great, and that you're having to do less and less of the therapy. But on the other side of that, Medicare are the people that make that decision on how they need to address the amount of care that's needed. And there's obviously some other programs, Medicare Advantage and some of the others that are out there that help with that process. And even if you were in a private insurer, that would be something that would be covered. They have a limit to coverage unless it had to continue, and there's other ways of addressing that. But there is some level of restriction on those areas of therapy. And again, it's on a yearly basis usually, but whether it's Medicare or private insurance. But I'm very happy to see able to overcome it. And if would get your name and address, we would be more than happy to have somebody call you and get you more information on that.
Great, thank you, Congressman. Along the lines of the question around coverage of Medicare, you had mentioned earlier about expanding the vision, hearing, and dental of Medicare. Can you explain a little bit about why sort of the history of that, about why it wasn't necessarily included in the initial coverage in Medicare, and how much of a need it is now?
Well, I don't understand why it was never included in the initial Medicare. It's probably a cost factor. It is going to be somewhat costly, but when you take a look at if we want people to be at home and be able to not have to be in a care facility itself with much higher costs, then they have to be able to, especially on the dental side, you need good nourishment. You need to be able to identify how to take care of your hygiene, to be able to identify clearly that it's not going to impact your heart and other organs of the body that show up in the dental exams also and blood tests. Vision, obviously, if you have glaucoma or some of the other issues that limit your vision, it's very hard to live alone, and we want to be able to save people from that and through preventative care. Just like in healthcare itself, prevention is a key factor, and that's why I've been promoting this, and people have helped us move this along to where it's at today. Dental has so much to do, hearing has so much to do, and vision with our day-to-day quality of life. And we want our seniors to have a good quality of life, and part of that is what this whole program will be about, and to be able to care for themselves at home and also be able to address the issues through their family if you can't care totally for yourself at home, and caregivers, other caregivers.
Thank you, Congressman. Dana, we do not have any other questions right now in the queue or on Facebook.
So I do have a question. So there has been so much talk about the first infrastructure bill that just got passed. Could you share a little bit of what is in the bill that you guys recently just passed, and then kind of talk about what you guys are negotiating right now?
Well, we're finalizing
a lot of.
We're negotiating.
We're negotiating with the Senate. We're negotiating with our friends across the aisle in order to bring a conclusion to some of these critical issues that we're facing. The Elijah Cummings Lower Drug Cost Act, we tried to get that through 3 times. We are still struggling, obviously, because it has failed in our committee, which has oversight and jurisdiction to Medicaid and to Indian Health Services, which means that we have oversight to the larger bills on healthcare in general. And the biggest issues are in home care, making sure seniors have that, and what we just talked about, your senses, sight, hearing, and vision, and to being able to make sure people get their medications and don't have that issue. And we're trying to get this across to people. It's not just an issue of getting medication at a cost that's doable for some people, at least, but for everyone. And we don't want to see our seniors and people that take these medications kind of say, okay, the doctor says 3 times a day. I can't afford 3 times a day. I have to do it in sections of 1 a day maybe, because that's all I can afford. Well, that's not healthcare. That's a mission to go on and be in critical care eventually in a hospital and be in such, because you're in such poor health by not addressing the medication issues and some of these other issues. And healthcare services across the board, reimbursement rates we're looking at for doctors. We're looking at expanding the number of doctors in America. I think 1,600 as a beginning. Obviously, we need more nurses. We're taking a very hard look of what this pandemic means and how to address it long term. I talked a little bit about that in my opening comments, but we can't go down this path again where the last number I saw is 617,000 of our fellow Americans have died, and we're not done with the variant yet. So we have to look at the complexity of the healthcare system, which we're doing, the needs of the healthcare system as far as the infrastructure that is going to address that, and part of that infrastructure is having enough of the personnel, doctors, nurses, technicians, to be able to address a growing America at almost 340 million people, but also an America that is complex and a world that's becoming more and more complex, and we're addressing those issues also.
And is there any discussion, or was there any funding for broadband internet?
Well, we have in the physical infrastructure part of the bill, the $1.2 billion, that $1 trillion, that bill is. Of that, $68 billion is part of the broadband increasing throughout America. And that is partially because so many of our rural areas are not only underserved, but they might not even, many of them don't even have service. And the same goes for tribal lands across America. And that not only hurts us because we don't have the ability to deliver telemedicine to the home and other ways of addressing computers that help out people. We do it with veterans as much as we can, but we have to get people that are remote to be able to have health care. The other side of that is also educating oneself, being able to address the economy of a region so the quality of life of all citizens in America gets better, and also obviously the youth of America, in my case, my grandchildren, the grandchildren of everybody that are listening, to make sure they get the best education possible, because we're in a competitive world and we need to do that. And the other thing is a better quality of life for all Americans. And it doesn't mean you have to be glued to the computer. I hope you don't get glued to it. But when you need it and when you have to get educated and when your local economy needs to compete, that's going to be available throughout America.
Excellent. And again, if you want to ask a question, please press *3. Congressman, that was great information. I know that this is an issue that we saw, impacting our members, is not having access to the internet. And I know, some of the rural communities, it's just not possible. So great to know that there are resources coming to help with that. And Brendan, I believe we have another question.
Yes, we do have a question. We're going to go to Marjorie. Marjorie, can you hear us?
Yes.
Wonderful, Marjorie. What's your question?
My question is, are they seriously considering the nursing home care? Because it's not like the salary isn't there, so the quality care is not there. And are they going to improve like the salary rate, or are they making funds available for home care? Because my husband was at a nurse, he had a congestive heart failure, and after the surgery and all, he had to go to a nursing home. The first one that they sent him to, he got sick. They didn't take care of him. The same night, he had to be taken back where he was back at the hospital for another week. He was sent to the other nursing home. There, he fell 2 times, and he had to be rushed to the emergency room because he got cut on the back of his head. And then back to the nursing home, and the same thing again. And the care is not there because they say that they're not getting the pay that they should be getting. So my husband demanded that he come home and die at home. So we brought him home. He lived 3 more months after that. But we are not trained. He was 68 years old, and I'm 74. And I'm afraid now that what have I got to look forward to? The nursing home don't have the money to pay their employees, and then don't have the care. And now when I have arthritis really bad, and my children won't be able to take care of me. And I think what is going to happen, and I think that the home care, I would rather be at home, but that is, I think they're just starting it now. There is one in Phoenix that I'm aware of on home care that they come and have somebody take care of things for you. But will there be more money put into that so we can be at home? Because I'm a native White Mountain Apache, and we eat native food, and our people that are in nursing homes, they don't eat because they don't like the food. They're not used to it because of their age, and they're already lonely, and it's all the restrictions they feel in there that they don't understand, and the care is not there, and they end up dying right away because they're lonely. The food isn't what it's supposed to be. So if you would put that into your presentation, and if the vote could come before Christmas, it would be good.
Marjorie, first of all,
I'm
sorry about
the passing of your husband and loved one, and that those issues occurred to him. I will say this: we have intentionally put. We understand that there's a lack of training and, in some cases, professionalism and management and long-term care facilities. We are passionately working on that and trying to fund both states and the federal government, trying to attempt to fund that at higher levels. We are going to do that. I mentioned earlier in my opening remarks about $190 billion worth of that, and that's for home care, community-based health centers, and one of the things we've done also is to increase your White Mountain Apache. I'm there frequently, and we have to make sure that during the pandemic, White Mountain especially, we had to intervene so that the people that had to be on dialysis, because the dialysis closed down in your region, we had to intervene to make sure that those patients can continue to get dialysis. But in general, we want to have it so that people don't have to travel 200, 300 miles round trip 3 times a week to be able to get that dialysis. And so we're working on those types of issues also. But we do have $190 billion that's directly to helping the issues you just discussed. And we have more money in there to address many other issues that are really so numerous that it's hard to discuss it in this amount of time. But if I'm out there soon, which I will be, we'll call my office, give us your address, and I'll come and see you.
And I'll just add to that. So this is Dana, and I'm really sorry to hear about your husband as well and all that happened to him in the long-term care facilities. And it's just heartbreaking when you hear those type of stories because it just shouldn't happen. You know, Arizona is one of the very first states in the entire country to create a home and community-based services when you qualify to go into a skilled nursing facility. So our program is called ALTEC, Arizona Long-Term Care System. And we have been working closely with the Access Director, Jamie Snyder, and she put together a proposal for additional funding to be able to create more home and community-based services. So this is something that we have been working closely with. And so you might want to look at the Arizona Department, actually at DES, they have I'm trying to think of it right now. They actually have a program that you can look at, and then you can also go to Access and look at the Arizona Long-Term Care System. You can call your area agency on aging, and there's also the Intertribal Area Agency on Aging. And so they have an information referral system, and they can talk to you about the ALTEC program and how to qualify. And you may also want to talk to an elder law attorney about that. And AARP, we realize that financial is really important, as well as making sure you have all your wills and advance directives in place. So we are actually working on a program in the winter months to be able to talk about that, because we now have transferred a lot of our advanced directives onto an online platform, and so we want to let people know about that. So make sure you keep an eye on the AARP.org/AZ for more information for you to help navigate your way through the long-term care system. Again, this is Dana Kennedy, and I want to thank you and everyone else for taking part of today's teletown hall discussing AARP's healthcare priorities and infrastructure legislation being negotiated by Congress and President Biden. We've been talking with our special guest today, Congressman O'Halleran. Congressman O'Halleran, thank you for joining us today. As we near the end of our call, Congressman O'Halleran, would you like to follow up on any of the questions or share any closing comments?
Closing comments.
I just feel that we need to hear from the American citizens on a much higher number of times. Don't say that I don't have an impact on my future, my life, the life of my grandchildren. The more people participate in the system as far as getting a hold of those that, like myself, that are responsible to you as citizens of the United States to be able to address the issues, whether you've paid into Medicare, whether you're on Medicaid, whether you're addressing issues that affect your quality of life that you've paid into. You deserve to be able to have the best care possible. And we want to make sure that occurs for you, but we have to be able to hear from you. The second thing is I appreciate what AARP has done today in putting us together. I will say this, that there's going to be a lot of changes, I believe, in the next few months before the holidays in addressing these issues. We've been debating many of these issues to make sure there's funding at the appropriate levels, not only today, but into the future. During the last couple of months and intensely over the last few days. And so I'm looking forward to those bills coming out of the House soon, moving over to the Senate, and finding enough votes in the Senate to be able to move them on to the President, who wants that type of legislation signed into law to help the people of America. And thank you for being on this event today.
Thank you, Congressman. And, you know, this is Dana Kennedy. We always want to make sure that we're getting you resources. Resources are so critical. If you are a caregiver, we have a lot of caregiving resources on our website, aarp.org/caregiving. We have a Prepare to Care guide to walk you through what you need to do to prepare to care for your loved one. We also have a local resource guide that gives you a lot of different resources locally in Arizona, and those are all on the website. You can also go to aarp.org/AZ, and we have a lot of information, different virtual events that you might be able to participate in. We know that this time has been very challenging to navigate, and AARP is here for you. We also have our coronavirus page at aarp.org/coronavirus. The high price of prescription drugs and support for family caregivers is top of mind for all of us, and we look forward to your guidance and updates, especially regarding progress on the infrastructure bill that's being considered. And to AARP members who have joined us on the call, thank you, and this concludes our call. Have a great day.